Hi, Mr. Tate. How are you today?
I'm well. How about you?
Good. My name is Jill. I'm your nurse today. So what brought you in?
I've been having a lot of problems with my allergies lately, a lot of bloody noses and stuffed up, having problems breathing.
Okay. Can you tell me when it started?
Oh, it's probably about a month, kind of when the weather started getting warmer.
Okay. How old are you?
I'm 27,
And what's your race?
Asian.
And what's your occupation?
I'm a financial analyst.
Okay. And do you have any other complaints?
No,
Okay. What about your past medical history? Do you have any medical conditions?
I'm a type 1 diabetic.
Okay. When were you diagnosed?
In February of 2008.
Do you have any complications from that?
No.
When was your last appointment with your endocrinologist?
Would have been January of this year.
Okay. And what was your last A1C? Do you remember?
5.3.
Awesome. And how often do you check your blood sugar?
Probably just about once a day.
Okay. What do you usually run?
Usually about 90 to 110.
Okay. And what time of day do you usually choose to check that?
Most of the time it's morning or night, or sometimes both.
Okay. And so you have allergies?
Yes.
How long have you dealt with this?
It's hard to say. I think I started having problems a lot when I was in junior high, but I really don't know specifically when, it all kind of started.
Okay. So do you have any specific triggers?
Probably, but not any specific that I know of.
Okay. And when do you find that they're the worst?
It seems like, you mean season or time of day or?
Either.
Well, I have a lot of problems when I sleep at night, specifically when I lay down. I get really stuffed up into the morning. It usually takes me a while to feel a lot better.
Okay. And do you have any food or drug allergies?
None that I know of.
Okay. And what medications are you on right now?
For the for the diabetes, I'm on Humalog, insulin, and Lantus insulin.
Okay. And what are your dosages?
The Lantus I take once 26 units at night, and the Humalog I take on a sliding scale counting carbs and a 1 to 10 ratio.
Okay, so you do 1 unit for every 10 carbs?
Yes, ma'am.
Okay. Do you take any over-the-counter medications?
I take Benadryl to kind of help with the allergy problems.
Okay, just as needed?
Yeah.
Okay. You take any vitamins or anything?
I take a daily multivitamin most days when I can remember, anyway.
Okay. What about your birth and development? Did you have any developmental delays that you know of as a child, or any problems with birth, anything?
None that I know of.
Okay. And did you have chicken pox as a child?
I did.
What about measles, mumps,
No, I didn't have measles or mumps.
rubella?
No.
Any other kind of things you
No.
can think of? Okay. And are you up to date on all of your immunizations?
Yes.
Okay. Did you get your flu shot this year?
I did. Well, it would have been last fall.
Fall 2012? Okay. And have you received a tetanus shot?
Yes.
When was your last one?
I think it was probably 2.5, 3 years ago.
Okay. Have you had any significant injuries like broken bones or stitches?
No.
Okay. What kind of surgeries have you had?
I've had a couple of oral surgeries. Once to have my wisdom teeth removed, and another time to have an extra tooth removed.
Okay. Do you remember the approximate years on those?
Both. Let's see. Well, the extra tooth would have been when I was probably about 10th grade in high school. So I guess that would have made it 02.
Okay.
And my wisdom teeth came out freshman year of college, so that would have been 04.
Okay.
05 actually. I guess the spring of 05.
Okay. And whenever you found out you were diabetic, were you hospitalized?
I was.
You were, okay. With ketoacidosis?
Yes.
Okay. How long was your stay?
I was there for 4 days.
Okay. And what year was that in?
It's 2008.
Okay. Any other hospitalizations?
No.
Okay. When have you last seen your physician?
My endocrinologist or my regular physician?
Your regular physician?
Probably would have been early last year in 2012.
Okay. And what about your job? Do you have any type of occupational exposures like asbestos or radioactivity, anything like that?
No.
Okay. And can you tell me if your family has any significant medical history?
None that I know of. I'm adopted, so
Okay.
I'm really kind of unfamiliar with my biological family.
Okay, so you don't really have any information on their health status?
No, I don't.
Okay, what about your adoptive parents? What kind of health are they in?
They're pretty good for the most part. I don't know of any major issues on either side.
Okay. Okay, we're gonna move on to your social history. What's your marital status?
I'm married.
Okay, what's your living situation?
I just live with my wife, no kids, but some dogs.
Okay. How's your support system?
That's good. You know, I obviously have my wife. I have a good group of friends and family, of course.
Okay. What's your educational background?
I have a bachelor's degree in accounting and finance and a minor in economics.
Okay, and what did you say your occupation was?
A financial analyst.
Okay. What about, do you have any religious or cultural beliefs, any preferences we need to know about, any restrictions,
No.
requests?
None that I know of, anyway.
Okay. What are your hobbies like? What do you like to do for stress relief? Your job sounds kind of stressful.
You know, I just like to play basketball, watch basketball probably more than play.
Mhm.
You know, I do things with friends, you know, movies and so forth.
Okay. Do you get to do much exercise?
Not as much as I'd like, but probably once or twice a week.
Okay. What about your sleep habits?
I sleep probably 5.5 to 6 hours a night. I usually don't need a lot. I try to go to bed fairly early, like 10, 11 o'clock. Most nights probably fall asleep around midnight, and I'm up at 6 every day.
Okay. Do you use alcohol?
Very rarely, socially probably.
Okay. Whenever you do drink, what kind of alcohol do you drink? Beer,
Just beer.
liquor? Okay. How many drinks would you say you have a week?
Probably 2.
Okay. What about smoking? Do you
Never.
smoke cigarettes? Okay. Do you use any chewing tobacco?
No.
Recreational drugs?
No.
Do you wear your seatbelt?
Absolutely.
Do you wear sunblock outside?
No, I'm not outside too often, but no.
Okay. And then kind of go back to your surgeries. Have you ever received any general anesthesia before?
No.
No. And have you ever received a blood transfusion?
No.
Would you be against that if you needed one for some
No.
reason? Okay. Do you have an advance directive or living will?
I do not.
Is that something you're interested in?
Yep, sure.
Okay. Who do you want to make decisions for you if you can't?
That'd be my wife.
Okay. Is there any reason you'd be scared to go home?
No.
Any abuse, anything like that?
No.
Have you ever had any thoughts of suicide?
No, ma'am.
Okay. Okay, so we're just gonna kind of do a general review of systems, and I'm just gonna go through each part of your body. You're gonna tell me if you've had any problems.
Okay.
So generally, have you felt okay?
Yeah.
Have you been feeling okay?
For the most part.
Any fever,
No.
night sweats,
No.
unexplained weight loss,
No.
any loss of appetite?
No.
Okay, have you had any problems with your skin? Any kind of itching, lesions, dry skin patches?
No.
Nothing to think of?
No.
What about your ears? Have you had any pain or drainage with your ears?
No.
Any hearing loss?
No.
And you don't wear hearing aids?
No, ma'am.
Okay, with your eyes, have you had any pain or drainage?
No, I mean every now and then they're itchy from the allergies, but no draining or
Okay.
anything.
Any vision loss?
No.
And you do wear glasses.
Yes, ma'am.
When was your last appointment with your optometrist?
I believe January of this year, just would have been a couple months ago.
Okay. And your optometrist does know that you're diabetic?
Yes.
Okay. So you've had drainage from your nose
Mhm.
and it's been stuffed up?
Yes.
Okay. You've had nosebleeds.
Yes.
How often do those occur?
Oh, probably about once a week I get one.
Okay. Do you have any pain in your nose?
No.
Okay. Have you had any pain in your mouth?
No.
You have any kind of cavities, anything like that?
No.
When was your last dentist appointment?
Probably would have been last summer, so probably June, July 2012.
Okay. Have you noticed any lumps or growths in your neck?
No.
Any pain when you move it from side to side?
No.
Any drainage from your breasts, from your nipples or anything?
No, ma'am.
Any lumps?
No.
Do they appear symmetrical to you?
As far as I can tell.
Okay. Have you had any chest pain?
No.
Palpitations, feel like there's butterflies in your chest or anything?
No.
Short of breath?
No.
Any swelling in your extremities?
No.
Any other kind of cardiac issues you could think of?
No.
Okay. Have you had a cough?
No, not really.
Any pain in your lungs?
No.
Have you had any constipation?
No.
Diarrhea?
No.
Any stomach pain?
No.
Nausea or vomiting?
No.
Any changes in your bowel habits?
No.
Okay. What about with your urination? Have you had any pain or frequency
No.
changes?
No issues there.
Urgency? Has the color been yellow?
Mm-hmm.
Okay. Have you been experiencing any bruising or bleeding that's abnormal?
No.
Have you ever been anemic?
No.
Okay. And you are diabetic?
Yes.
Do you have any other endocrine issues?
None that I know of.
No thyroid problems, anything like that?
No, ma'am.
What about your musculoskeletal system? Any pain in your bones or muscles, joints?
No.
Any weakness you've noticed?
No.
Any changes in your gait?
No.
Neurologically, have you had any issues there?
Not that I know of.
Headaches?
No.
Dizziness?
Mm-mm.
Confusion?
No.
Tremors?
No.
Seizures?
No.
Okay. And mentally, have you had any thoughts of suicide?
No.
Have you been feeling depressed?
No.
Any history of any kind of psychosis?
No.
Have you experienced any mood changes?
No.
Okay, and do you have any reproductive concerns?
No.
No pain, anything?
No, ma'am.
What about testicular exams? Do you perform those?
I do.
Okay, how often?
Probably once a month.
Once a month? Okay, perfect. Okay, Mr. Tate. Do you know what your height is?
5'11",
Okay, what about your weight?
about 220.
When was the last time you took it?
My weight,
Yes.
a couple days ago.
Okay. I'm gonna go ahead and get your vitals. Okay, your temperature is 98.3. Your heart rate is 76 and your respiratory rate is 14. I'm gonna get a blood pressure cuff. Can I get you to take your jacket off, please? And I forgot to ask you earlier, since you're diabetic, what kind of diet do you follow?
I try to do low carb.
Low carb? Do you watch your fat intake as well?
Sometimes, but not as well as I should.
Okay. And have you met with a diabetes educator before?
Yes.
I'm just gonna go ahead and get your blood pressure. Okay, and I'm gonna go ahead and take off your shoes. Okay, and I'm just gonna inspect and kind of palpate your skin. Okay, so it appears warm and dry. It's symmetrical and has uniform thickness. The color is appropriate and I don't detect any odor. No lesions are present and the skin turgor also appears normal. The skin is mobile. Okay, your blood pressure was 137/82, so it's a little bit elevated. Okay, so then I'm just gonna look at your hair. Gonna get a pair of gloves on. Okay, so the hair appears shiny, thick and black. It's smooth and it is evenly distributed. So I'm just gonna look at your nails now. Can I see your other hand? Okay, so the nails appear short. They're symmetrical with no pitting, peeling, or ridging. And then I'm going to have you put your fingers together like this for me. And no clubbing is present. I don't see any warts, cysts, swelling, or redness. The nails are firm, thick. They're uniform and adequately adhere to the nail bed. And then I'm just going to have you sit up on the side of the bed, and I'm going to inspect your lymphatic system. I'll go ahead and get this off of you. Okay, and in just looking at you, I don't see any enlarged lymph nodes or any redness or any swelling of any kind. So I'm just going to have you tilt your head slightly forward, and I'm just going to start feeling. Your occipital nodes are normal, as well as the postauricular, the preauricular, the carotid and submandibular, and the sublingual are also normal. And I'm just going to feel your anterior cervical and your posterior cervical. And then your supraclavicular. This felt good as well. I'm going to take your arm. Let's see this one. And I'm going to feel for your epitrochlear. And then I'm going to go up into your axillary. Okay, those feel normal as well. And then I'm going to do your popliteal. Those don't feel enlarged either. And then I'm going to have you lie back. No, this way. Sorry. And then I'm going to feel your inguinal. And those feel normal as well. So you can go ahead and sit up again. Sit up again. Okay, so I'm just going to inspect your head, scalp, and face. I'm just going to kind of look at you. It appears symmetrical, no lesions, and it's an appropriate size. I'm going to have you smile real big, and then close your eyes, and then open your eyes. Okay, can you raise your eyebrows for me? Okay, all facial features appear symmetrical. I don't see any presence of tics or any unusual features. So then I'm just going to take your glasses off for a second, and I'm going to palpate your head, your face, and your scalp. Do you feel any tenderness anywhere?
No.
No? Okay. So the head feels symmetrical, no tenderness was noted, the scalp moves easily. So then I'm going to palpate the temporal arteries. Do you feel any tenderness in there?
Nope.
Okay, and then I'm going to grab my stethoscope. And I'm just going to listen with the bell of my stethoscope for bruise. No bruises were detected. also didn't feel any hardening or anything in the temporal arteries. So now I'm going to inspect and palpate your salivary glands. And I don't detect any masses or enlargements there either. So now we're going to move on to your neck. Just going to inspect it. It appears symmetrical. The trachea is midline. There's no deviation. I don't see any signs of jugular vein distension or carotid artery prominence. So now I'm going to palpate. And I'm going to have you relax your head. And then I'm going to have you swallow. Okay, the trachea is positioned midline. No tug is present. Can you swallow one more time? Yes, no tug is present. Okay, did you feel any tenderness whenever I was doing that?
No.
Okay, good. So the hyoid bone and cartilage is non-tender and it moves freely with swallowing. I'm going to have you gently hyperextend your neck and then swallow. Okay, was there any tenderness there?
No.
Okay, so the thyroid is non-tender, no nodules were felt. It's firm, and the lobes are small and firm. So I'm just gonna have you turn your neck from side to side, kind of back and forth like this. You feel any difficulty turning or anything?
No.
Okay, so range of motion is normal. Okay, so now I am going to inspect your ears. So I'm just going to look at your auricles and your mastoid area. Okay. The ears are symmetrical. No deformities or lesions are present. They're normal in size and shape. So I'm just going to palpate the auricles and the mastoid area. You feel any tenderness?
No.
Okay, so the auricles and mastoid area are not tender. No swelling or nodules are detected. So I'm going to inspect the canal. Place the cone on. Sorry. So I'm just going to look at the canal right now. Okay, so no discharge or foreign bodies are noted. There is a small amount of earwax in the canal. The color is appropriate and no lesions are noted. So now I'm going to move on to inspect the tympanic membrane. Okay, and no bulging is present in the tympanic membrane. No perforations are present, and the membrane is a pearly gray color. So now we are going to perform the whispered voice test. So I'm going to be about 1 to 2 feet away from you. I'm going to have you plug your left ear with your finger, and I'm going to whisper 3 letters, and you tell me what I'm saying, okay?
XST.
Okay, and now let's try it over here. It'll be a different set of letters.
FCR.
Okay, perfect. And now we are going to do the Weber and Rhyme test. So I'm going to get my tuning fork. Okay, and I'm going to make this vibrate. I'm going to put it right on your head right here. And you tell me whether you hear it the same in both ears or you hear it more in one ear or the other.
Sounds about the same.
Okay, good. And then now I am going to We're gonna test whether you hear better by bone conduction or air conduction. So tell me whenever, I'm gonna put it like this, and tell me whenever you stop hearing it, and then I'm gonna switch it, okay?
Okay, I can't hear anymore.
Okay? You wanna do it again?
Yeah. Okay, I can't hear. Okay, that's
And now you can't hear it? Okay, perfect. Okay, so now we are going to test your eyes. I placed the Snellen chart back there. So I want you to cover each eye and then read me what you see.
okay, the bottom line is W V X P B Z S U W G.
Okay, and then with your other eye?
It's W V X P B Z S U W G.
Okay, and then uncover both eyes and read it.
W V X P B Z S U W G.
Okay, perfect. And now I'm just gonna look at your eyebrows. They appear symmetrical and normal. The hair is dense and not missing in any spots. Then I'm going to inspect the orbital area. I'm going to remove your glasses. I see no edema, puffiness, or sagging tissue. I'm going to inspect the eyelids and palpate the eyelids. The eyeball feels firm with no nodules present. And then I'm going to have you open your eyes real wide and then close them. Okay, so he's able to open and close normally. No flakiness or redness or swelling is present. I'm going to pull down the lower eyelids. Okay, the sclera is white with no discharge present. The conjunctivae is pink. The external eyes, the cornea is clear and sensitive. The iris is brown. The pupil size is 3+. Okay, and then eyes are perla. So then I'm going to have you follow my finger. Okay, the 6 fields of gaze are normal. And then I'm going to get the ophthalmoscope. I'm going to dim the lights. Okay, and the red reflex is present. Okay, and the optic disc, the shape was sharp and well defined. I was not able to see the macula, and the blood vessels did appear normal. Okay, Mr. Tate, so now we're going to look at your nose and sinuses. So I'm just going to inspect I'm going to take off your glasses. I'm just going to inspect your external nose. And I'm going to palpate the ridge and soft tissue. Is that tender?
No.
Okay, so the nose is symmetrical. There's no apparent deviation. It's an appropriate color and the nares are symmetrical. There's no cartilage or bone displacement or masses detected. So now I'm going to evaluate the patency of the nares. Have you tilt your head back. I'm also going to inspect the nasal mucosa and nasal septum while I'm doing this. The color of the nasal mucosa is pink. The septum is aligned. There's a small amount of clear discharge. There's no perforation or swelling of the turbinates. And the nares appear patent. Can you plug one side for me and then breathe? And then on this side? Does it feel the same? Can you breathe equally? Yeah. Okay, so then I'm going to inspect the frontal and maxillary sinus for swelling. There's none present. So then I'm going to palpate and percuss the frontal and maxillary sinuses. And is that tender?
No.
Okay, so there's no tenderness or pain. There's also no swelling noted. So now we're going to move on to your mouth. I'm just going to look at your lips and I'm going to palpate them. Okay, there's no edema that seems to be present. The color is pink. There's no abnormalities and the lips are symmetrical. I'm going to grab some gloves. Okay, so now I'm just going to inspect and palpate your gums. Is that tender at all?
No.
Okay, so the gums are pink and non-tender with no lesions present. I'm going to inspect the teeth. I'm going to use my light for this. Open your mouth. Okay, there are no caries or loose or missing teeth. The patient does have a permanent retainer in the bottom teeth. So now I'm going to look at your tongue and buccal mucosa. Can you stick out your tongue for me? Okay, so there's no swelling, no tremors. Can you move your tongue around for me? No limitation of movement. The tongue is midline. There's no deviation. It is dull red and moist. And then I'm going to get a piece of gauze. I'm going to palpate your tongue. And I'm going to look at the lateral sides. Okay. So there are no lumps, nodules, or ulcerations. So I'm going to have you open your mouth. I'm going to inspect the palate and the uvula. I'm going to have you tilt your head back a little bit. So it appears dome-shaped with transverse rugae. The uvula is midline with no nodules present. And can you say ah for me?
Ah.
Okay, the uvula rises, but it stays midline. Yeah, I'll let you rest for just a second. And then I'm going to inspect the tonsils and the oropharynx. Okay, the tonsils are small and pink. There's no exudate noted. The posterior wall of the pharynx is smooth and glistening. And then I'm going to elicit your gag reflex. Okay, and gag reflex is present. Okay, so now we're going to do your chest and lungs. So I'm just going to inspect the front and back of your chest. Step behind you. Okay, so the clavicles are superiorly prominent. The sternum is flat without a lot of extra tissue. And the anterior posterior diameter is less than the lateral diameter. So I'm just going to watch you breathe for a second. Just breathe normally. The respiratory rate is regular with a normal pattern, and he has a respiratory rate of about 14. So I'm just going to look at your chest movement while you're breathing. The chest is symmetrical with no bulging or use of accessory muscles. And I don't hear any apparent stridor or wheezing. So now I'm just going to palpate your chest. I'm going to go back here and evaluate the thoracic expansion. You take a deep breath for me. Okay. So the chest feels symmetrical. Thoracic expansion is normal. There's no crepitus or vibrations. And so now I'm just going to have you repeat 99 over again.
99, 99, 99, 99, 99.
Okay. So tactile firmitus is normal. And then I'm just going to percuss. Here. Okay, so the tones are resonant, and now I'm just going to auscultate your breath sounds. You take a deep breath. And again. And again. And again. Okay, so no adventitious breath sounds were noted, and his lungs were clear in all four quadrants. So now I'm just going to have you can say 99 or any words, and I'm just going to listen for vocal resonance.
99, 99, 99, 99.
Okay. Vocal resonance was normal. And so now we're going to move on to your heart. So I'm going to look for the apical impulse at the 5th intercostal space. And I'm going to palpate for that. At the apex, the left sternal border, and the base. Okay, there's no presence of thrills, heaves, or lifts. So now I am going to percuss. And that shows a normal cardiac border. So now I am going to auscultate. Can you hold your breath for me? Okay, you can breathe normally. Okay, so normal S1 and S2 sounds were heard. There were no murmurs or extra heart sounds detected. Okay, so now we are going to look at your circulatory system, your blood vessels. So I'm going to palpate your arterial pulses. So I'm going to do your radial pulses first. The rate is regular at about 76 beats per minute. And pulses are strong at about 3+. I'm going to also palpate the pedal pulses. And those were the same. So now I'm gonna auscultate for, I already checked for a temporal bruit and it was not there. So now I'm gonna auscultate for a carotid bruit. That's using the bell of my stethoscope. And no bruit was detected. I'll also check for a femoral artery bruit. And at that time, I'll also inspect for JVD. So I'll have you lay back. And I'm going to put you at a 45-degree angle. Okay. Sorry. Okay, no femoral artery bruit was detected either. So I'm inspecting at a 45-degree angle for JVD, and none is present. I'm going to inspect the extremities now. Okay, so the skin color is appropriate for the patient. No varicose veins or edema was noted. Hair is present, and there is no muscular atrophy. So now I'm going to palpate the extremities. Is there any tenderness?
No.
What about in your hands?
No.
Okay, so the extremities are warm. The pulses are once again 3+. No tenderness is noted, and there is no pitting edema. Okay, so now we're going to look at your abdomen. I'm just going to inspect it. It appears normal. The abdomen is symmetrical. The skin color is appropriate, and no masses or bulges are detected. So I'm just going to lay your head down. And then I'm just going to have you raise your head up, contracting your abdominal muscles, kind of like you were doing a crunch. Okay, and then no masses, hernias, or muscle separation is detected. You can relax now. So now I'm just going to auscultate your bowel sounds. And I'm also going to auscultate for venous hums around the umbilicus, and also bruits over the renal arteries and aorta. And that'll be using the bell on my stethoscope. Okay, so no bruits were heard over the aorta or renal arteries, and no friction rubs were noted over the liver or spleen. The vowel sounds were normoactive in all 4 quadrants. So now I'm just going to percuss. I'm using indirect percussion. so no dullness was noted over the spleen. No gastric air bubbles were detected, and the liver did not appear enlarged. So now I'm just going to do some light palpation, and you tell me if you feel any tenderness.
No.
Okay, so no tenderness is noted. No muscular resistance or masses were detected. So now I'm going to move into deep palpation. Okay, so the umbilical ring has no bulges or nodules. The liver was not palpable, neither was the gallbladder. No bulges or masses were felt, and I did feel the aortic pulsation. So now I'm just going to test the abdominal reflex. Okay, so the abdominal reflex was present. Now I'm going to have you sit up on the side of the bed. And I'm going to get behind you and percuss your kidneys, and you tell me if you feel any tenderness at all. Do you feel any tenderness?
No.
Okay, so no tenderness was noted. Okay, so now I'm just going to inspect your skeleton. I'm just going to compare your sides and just kind of look you over. Okay, so the musculoskeletal system appears aligned and symmetrical. No gross deformities were detected. And the size of the extremities are appropriate and symmetrical with one another. So now I'm just going to look at the skin and the subcutaneous tissue. Okay, so the color appears appropriate. There are no swellings or masses detected. So now I'm just going to inspect the muscles. I'm going to pull this up a little bit. I'm also going to look at your back. You can put your glasses back on. Okay, so the muscles didn't appear to have any spasms. They were symmetrical, and the size of all the muscles were pretty much the same on both sides. So now I'm going to palpate the bones, joints, and muscles, and you tell me if anything feels tender. Okay, did you feel any tenderness?
No.
Okay, so now I'm going to test the range of motion in all of your joints. Also, when I was palpating, no heat, tenderness, crepitus, or crepitus was found, and the muscle tone was normal. Okay, I'm gonna have you lie back. And I'll just have you turn your neck from side to side again. Okay, still no pain with that?
No.
You didn't find any difficulties?
No.
Okay. Okay, so now we are going to do the straight leg test to test your lower spine. So I'm having you lie supine, and I'm going to have you raise your leg straight up in the air with your knee flexed. Okay, other side. And did you feel any pain?
No.
Okay, now can you roll over on your stomach? And then I'm going to have you do pretty much the same thing. This is called the femoral stretch test. Okay. Did you feel any pain there?
No.
Okay. You can sit back up. Okay. Okay, so now we are going to do the thumb abduction test. And so what I'm going to have you do is I'm going to have you place your hand palm up and then raise your thumb perpendicular to it. And then I'm going to apply a downward pressure on the thumb, and I'm going to test your muscle strength. Okay, and you did have full resistance, which is what I expected. And so now we're going to do it with this hand. Place your thumb perpendicular, and I'm going to apply downward pressure. And you had full resistance there as well. And then now we are going to do what's called Tennille's sign. And I'm going to strike your wrist with my index finger where the median nerve passes under the flexor retinaculum and then the carpal ligament. And you tell me if you have a tingling sensation that radiates from the wrist down your hand. Okay, did you feel anything?
No.
No? Okay, and then we're going to do the Phelan test. And I'm going to have you put both of your wrists in a palmar flex position with the dorsal surfaces pressed together, like this. And we're going to do this for 1 minute. Okay. Did you feel any numbness or tingling?
No.
No? Okay, I have no reason to suspect that you have carpal tunnel syndrome. Okay, so now we are going to do a hip assessment. We're going to do what is called the Thomas test. And that is going to have, you're going to lay supine, and we're going to fully extend one leg flat on the table or on the bed, and then we're going to flex the other leg knee to chest. So you're going to bring your knee up and then keep this one down. Okay, and let's try it with the other leg. Okay, and so no hip flexion contracture was noted. Now we're going to do the Trendelenburg test. So I'm going to have you stand up. Come over here. Okay, and then I'm going to have you stand on one leg, and I'm going to stand behind you. Okay, and I'm looking for a change in the level of the iliac crests. Okay, and then you can switch. Okay, and there was no drop in the iliac crest. You can have a seat. Okay, and so now we are going to test for knee allotment. I'll have you lay down. Okay, and what I'm going to do is I'm just going to apply downward pressure. And then I'm going to push the patella sharply downward. And then I'm going to release the pressure and keep my finger slightly touching it. There was no effusion present. I'm going to do it in this leg. Okay, no effusion present in that one either. Now I am going to test your cranial nerves. So for the first one, I'm going to have you close your eyes and close one nair so that you only have one open. And you're going to identify the smell for me.
It smells like lemon.
Like lemon? Okay, that's right. And then cranial nerve 2, 3, and 4 are tested. You can let go now. Are tested in the eye exam. So now I'm going to test sharp versus dull. So you're going to tell me whether what I'm touching you with is sharp or dull.
Okay. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. Dull. Dull.
Okay. So cranial nerve 5 is intact. Cranial nerve 6 was tested in the eye exam. And so now we'll test cranial nerve 7. I'm going to have you raise your eyebrows up, wrinkle your forehead, and then I am going to have you smile. Puff out your cheeks. Purse your lips and then blow out. And then I'm going to have you squeeze your eyes shut. Okay, so cranial nerve 7 is also intact. So then I'm going to test your response to superficial touch and superficial pain. So close your eyes and then tell me where I'm touching you at.
Like forearm,
What side?
left, right forearm,
Okay, and can you feel the pain?
yes,
And then what about there?
yes.
Okay, and so then I'm going to get my tuning fork. I'm going to test if you can feel the vibration over your joints and bony prominences. You feel that?
Mhm.
You feel that?
Mhm.
And then here.
Yep.
Here.
Yes.
Do it on your lower extremity. You feel that?
Mhm.
Here.
Yes.
Here.
Mhm.
And here.
Yes.
Okay. Okay, so now I'm going to evaluate the perception of position sense by moving your finger. You close your eyes and you tell me whether I'm moving it left, right, or up or down.
My left or your left?
Your left.
Left. Up. Right. Left. Down. Up. Right. Left.
Perfect. Okay, so then I'm going to give you 3 different objects. I'm going to have you fill them with your eyes closed and you tell me whether you can tell what they are.
It's a car key.
Okay?
It's an ink pen.
Okay?
It's a cell phone.
Okay. And then I'm going to take 2 needles and I'm going to touch your different positions of your arm and you tell me if it feels like 2 needles or 1 needle.
2. 1. 1. 2. 1. 2. 1.
Okay, that was actually 2.
Well, 1.
So it looks like it is about 10 millimeters. So now I'm going to draw a letter or a number on your hand, and with your eyes closed, you tell me what letter I made.
U.
Uh-huh.
K. X. O.
Okay, perfect. And then I'm going to touch different areas of your body, and you tell me where I'm touching.
Left arm. Right shoulder. Left calf. Right knee. Left cheek.
Okay, perfect. Okay, so now we are going to test the deep tendon reflexes. First, I'm going to do your bicep. So I'm going to hold your arm at a 45-degree angle. And on this one, I'm going to hit my thumb, okay? Instead of hitting you. Okay. Let the bicep contract. So then we're going to do the brachioradial. Hold your arm like that. Support it. Okay. And then we're going to do the tricep. And then the patellar. Okay. And then the Achilles. Let's support your foot. And then I'm going to test for clonus. Okay, and no clonus was detected. And then I'm going to test for the plantar reflex. and plantar flexion of the toes was noted. To perform the female breast exam, I would have the patient seated with her arms hanging loosely at her sides. I would then inspect the breast, comparing size, symmetry, contour, venous patterns, and looking for dimpling or changes in the skin color. I would also look for any extra nipples or skin lesions. I would then compare the areolas and nipples for size, shape, and color, and then I would look for inversion of the nipples or retraction. I would then have the patient extend her arms overhead and re-examine. Then I would have her put her hands on her hips and re-examine once again. And then I would have her sit and then lean over. And I would also have her in a recumbent position. I would then move on to palpate the breast. I would do this in all 4 quadrants, including the talus spence, and then over the areola, and I would look for any lumps or nodules. And if her breasts were large, I would do a bimanual examination. I would then move on to palpate the nipples, and then I would compress them gently to see if I could elicit any discharge. I would then move on to palpate the lymph nodes in the apex, medial and lateral aspects, and then the anterior and posterior walls of the axilla. And I would also look for nodes in the supraclavicular area. I would then palpate again with the patient sitting, and then once again supine with one arm behind her head and a towel underneath her shoulder. In order to perform the female genitalia exam, I would place the patient in lithotomy position. I would then inspect her pubic hair, looking for any characteristics. I would look at the distribution, if it was coarse or sparse. I would then inspect and palpate the labia for symmetry, and I would look at the color. I would look for any caking of discharge on the labia, and I would also look for any signs of inflammation, swelling, or excoriation. I would then move on to inspect her meatus as well as her vaginal opening. I would look for any signs of discharge, any lesions, any polyps or fistulas. I would then move on to milk the skin glands and inspect the Bartholin glands. I would look for the presence of any cysts by palpating. I would then inspect and palpate the perineum. I would look for smoothness, tenderness, inflammation, any fistulas, any lesions, or any growths. I would then look for bulging from the vaginal opening. As I would have the patient bear down, I would look for any signs of the uterus or the bladder protruding. I would then also assess for any urinary incontinence at that point as well. I would then move on to inspect the perineal area. I would also assess the anus and look for the presence of any lesions, fissures, any excoriation, inflammation, any bleeding, or any kind of masses or growths. I would move on to the internal vaginal examination. I would start by choosing a speculum. I would do this based on my patient's age, size, as well as her history. I would then begin to insert the speculum. I would start by placing a finger in her vagina, and then I would apply downward pressure. I would then use my finger to separate the labia minora so that the vaginal opening was clearly visible. And then I would slowly insert the speculum. I would insert at the length of the vaginal canal, and then I would look for the cervix and position accordingly. I would use my thumb to open up the blades, and then I would lock the speculum blades into place. I would then inspect the cervix. I would look at the color, position, size, the presence of any discharge, any polyps. I would, at this time, take any samples for a pap smear or for any cultures that I may need. I would then inspect the vaginal walls for color and surface characteristics, the presence of any rugae, as well as the presence of secretions. I would do this as I was removing the speculum blade. For the bimanual examination, I would insert 2 fingers into the vagina and tuck my thumb kind of into the palm of my hand. I would begin by palpating the vaginal walls, assessing for smoothness, tenderness, any cysts, nodules, or masses. I would then palpate the cervix. I would assess the size, shape, position, length, and mobility. I would then move on to palpate the uterus. I would assess the location of the uterus. I would look to see if it was maybe retroverted. I would assess the size, the shape, the contour, the mobility, and the tenderness. I would then move on to palpate the ovaries. I would assess for the size, shape, consistency, tenderness, and I see if I could possibly feel any cysts or anything like that. I would then palpate the adnexal areas for any masses and tenderness. In order to perform the rectovaginal exam, I would start by assessing the sphincter tone. I would first insert a finger into the vagina and press my middle finger against the anus and ask the patient to bear down. At this time, I would insert a finger into the rectum, just past the sphincter. I would then palpate the anorectal junction, and then just above it, I would ask the patient to tighten and relax, and then I would observe her sphincter tone. I would then palpate the rectovaginal septum. I would note any nodules. I would also assess the thickness. I would then move on to palpate the posterior aspect of the uterus. I would also palpate the anterior and posterior rectal wall for masses, any polyps, nodules, or any irregularities or tenderness that may be present. And at this time, I could also guaiac any stool to assess for any occult blood. To perform the male genitalia exam, I would start with inspecting the pubic hair. I would assess for characteristics, any smoothness, coarseness, or the distribution of the hair. I would look for any spots where it may be more sparse than others. I would then move on to retract the foreskin if the patient is uncircumcised. I would inspect the glands of the penis. I would assess for color, any excoriation. I would assess the external meatus of the urethra and look for any discharge coming from there. I would then palpate the penis for any tenderness or induration. And then I would move on to inspect the scrotum and ventral surface of the penis. I would look at the color, the texture. I would look to make sure that it was symmetrical. I would look for any thickening or the presence of any type of inguinal hernia. I would then transilluminate any masses that I may find in the scrotum to see if they are fluid filled. I would then palpate the inguinal canal for a direct or indirect hernia. And then I would move on to palpate the testes, the epididymitis, and the vasa differentia for consistency, size, tenderness, bleeding, lumps, or any nodules. To do an exam on the anus, rectum, and prostate, I would begin by inspecting the sacrococcygeal and perineal areas. I would assess the skin characteristics, look for any lesions, dimpling, tufts of hair, inflammation, or excoriation. I would then move on to assess the anus for skin characteristics, looking for any lesions, fissures, hemorrhoids, polyps, fistulas, bleeding, or any rectal prolapse. I would then move on to assess the sphincter tone. I would do this by lubricating my finger and pressing it against the anus, and then I would ask the patient to bear down so that the muscles would relax, and then I would insert the finger. I would palpate the muscular ring for any smoothness and look for evenness. I would then move on to palpate the lateral, posterior, and anterior rectal walls. I would look for any nodules, masses, polyps, tenderness, or irregularities. I would then palpate the posterior surface of the prostate gland through the anterior rectal wall, and I would assess for size, contour, consistency, and mobility. If I was doing this on a female, I would then palpate the cervix and the uterus through the anterior rectal wall, assessing for size and shape. also looking for any type of irregularities, and I would assess the mobility and position as well. I would then have the patient bear down, and I would palpate deeper, and I would once again look for any tenderness or nodules. At this time, I could then guaiac the stools for any occult blood.